Hello everyone and welcome to this video. Today we'll be taking a look at how to work with a SimPlant Certified lab. It's actually quite simple. There are only two protocols to follow, partially edentulous or fully edentulous case. The process is the same for both protocols. First, the doctor will acquire the information required to perform the case. That information is then sent out to the SimPlant lab, where a complete digitized file will be generated. Now from that, you'll be able to work with your SimPlant lab to plan out the case with the implants in various ways. Once the case is approved, the SimPlant lab will then be ordering the guides and also some additional products for immediate temporization, for example. So the bottom line here is to simplify the logistics of guided surgery to make it simple for you to really concentrate on the two most important things: planning out your case and then performing your surgery. Now, for a partially edentulous case, all you need to send your certified lab is two pieces of information. The first one is bone information in the form of a CT or a CBCT scan in the DICOM format, and number two, impressions, basically business as usual, upper and lower. It can either be a conventional impression or a digital impression using an intraoral scanner. Now, a couple of conditions here for the bone information. It has to be an open bite, meaning that we need about 5 millimeters of separation between the upper and lower arch, and that is to just get some better results when we merge optical scan information to the bone information. The other condition here is that it needs to be a full arch scan, once again to enhance the accuracy of the surgical guide. Now, as for the impressions, it is extremely important to use a silicone-based impression material if the model is not going to be poured up immediately. Now, you can use alginate, however, the model needs to be poured up. Obviously, because we want to prevent any inaccuracies being introduced inside the model, and so just like a crown that doesn't fit well because of a bad impression, a surgical guide will not fit correctly if the impression is incorrect or has been degraded. Now finally, let's move on to the fully edentulous case. Basically here, all we need is DICOM information, meaning that we need cone beam information in the form of the protocol called the dual scan. And so we'll have a little video that's coming up just very shortly on the exact process of the dual scan and some tips and tricks to prevent some common pitfalls. So essentially, the dual scan is, as its name states, two scans. The first one is with the patient with a denture, radio-opaque markers, and a bite registration. And then the second scan is the prosthesis and the radio-opaque markers alone, so no patient. So the patient only gets scanned once here. Now, a few conditions here for the second scan. First, the denture must be metal-free for obvious reasons. If there's too much scatter, the scan will be unusable. The second, the denture has to reflect the desired aesthetics of the final restoration, and finally it has to fit well. That means there cannot be any air gaps between the denture and the soft tissue, and that's particularly important for tissue supported guides. Alright, so this concludes this video. If you want more information, please contact your SimPlant lab, or you can come into contact with your local SimPlant representative. This product here is only available in Canada. Thank you.